Then we will jump to normal axis. In the normal axis, as I discussed in the previous video, we have a normal axis between -30 till +90 from the AVL, lead 1, lead 2, and AVF. Okay, so in this area called normal axis deviation, I discussed in detail in the previous video, so we don't have to repeat in this video. Okay, so the cardiac axis, as I mentioned it, describes the overall direction of electrical spread within the heart. To determine the cardiac axis, we have to look at leads 1, 2, and 3. Lead 1, lead 1, lead 2, and lead 3. So because of the lead 1 is a positive deflection and lead 2 also is a positive deflection, also as I mentioned it in the previous, here we have AVF. AVF, it's a positive deflection. Also lead 3 is equal positive and negative deflection, so it regards as a normal axis deviation. Okay, so as I mentioned it, in the axis of the heart or right axis deviation, lead 3 have the most positive deflection and lead 1 should be negative. It means that the lead 3, it should be like that. Okay, the most positive deflection, while the lead 1 should be like that. Negative deflection. So when we see lead 1 is a negative deflection, while the lead 3, the most positive deflection, it belongs to right axis deviation associated with right ventricular hypertrophy. Okay, in the case of left axis deviation, lead 1 had the most positive deflection. Lead 1, in this case, is right axis deviation. In left axis deviation, the lead 1 is the most positive deflection, like that. Okay, the most positive deflection. This is the lead 1. While the lead 2 and lead 3 are negative. Both lead 2 and lead 3 are negative, like that. Okay, negative deflection. So when you see this, it belongs to left axis deviation. This is about the normal axis, right axis, and left axis deviation. Here we have another point which is very important. P wave should be normal. Okay, P wave is normal or not. So the next step is to look at P wave. So in P wave, we have to ask that P wave is present or not. Okay, it's important to know. And if so, is each P wave followed by QRS complex or not? Okay, this is the second one. The third one, do the P wave look normal? Check the duration, direction, and shape of the P wave. The fourth one, if P wave are absent, is there any atrial activity? So it's important to know why, because if P waves are absent, there is an irregular rhythm. It may suggest a diagnosis of atrial fibrillation, for example. Okay, so on the other hand, we have a shape, another shape, abnormal shape of P wave, which is called P Mitrale and P Pulmonale. It's important to know P Mitrale. So it's important to know where we have to look for P Mitrale and P Pulmonale. Here we have lead 1, lead 2, lead 3, and V1. it's important. Okay, you have to memorize. Okay, here we have lead 1, lead 2, lead 3, and V1. We are looking for P mitrale and P pulmonale, but it's a normal P wave. Okay, there is a normal P wave. It's a normal also. Okay, so in P mitrale the P wave is just like that. Okay, this is the shape of P mitrale, while the shape of P pulmonale is just like that. Okay, this is the shape of the P pulmonale, which the P mitrale suggests that left atrial enlargement. There are a lot of causes. One of them is systemic hypertension or stenosis of mitral valve, for example, while in P pulmonale it represents a right atrial enlargement. Okay, there are a lot of causes also, such as COPD, chronic obstructive pulmonary disease, and in pulmonary embolism or pulmonary hypertension also can cause P pulmonale on ECG. So here in P mitrale also we have biphasic. It means that the P wave is positive deflection and negative deflection. It's just like that. Positive and negative deflection called biphasic. You can see in V1. Okay, so it's important to know, and also in V1 P pulmonale is biphasic also. Okay, so that's all about the P wave, P mitrale, and P pulmonale.